if you do feel like things are off or your health has, changed, it's a good idea to seek out medical help to see if this could be something other than just, oh, this is my life, this is how things are. And that it can happen at really almost any age. It's not 45, it's not necessarily 42. It can happen almost at any age.
I'm Rees. This is the Sofia Unfiltered podcast where we bring together thought leaders, wellness entrepreneurs, makers, and emerging health leaders. We're here to have raw, unfiltered conversations because sharing your stories has the power to change lives, help others heal, and transform the way we take care of ourselves. Here we go. Welcome back to Sofia Unfiltered, the podcast where we talk about what's really going on beneath the surface of wellness. I'm your host, Rees, and today we're diving into something that so many women are feeling, but not enough are talking about. You're exhausted, but you can't sleep. You're overwhelmed, but you keep pushing. Your body feels off. Every lab test says you're fine. This is a silent burnout that so many women are facing, one that's tied not just to stress, but to hormones, mental health, and how our modern lives are wired to keep us stuck in survival mode. So today, I'm thrilled to be joined by Dr. Ansari. She's a double board certified family and lifestyle medicine physician who's passionate about helping women reclaim their energy, balance hormones, and feel whole again without relying on quick fixes or the one size fits all advice. Let's get into it. Dr. Ansari, thank you so much for being here.
Thank you for having me, Riley. I'm so excited.
Yeah, do you want to just tell our guests a little bit about yourself, your background, or your practice?
Sure. So I am board certified in both family and lifestyle medicine. And I basically worked for a good chunk of time, about 6 years, in more of, an insurance based clinic that was really fast paced, didn't get so much time with my patients. And I just wanted something more, especially that was lifestyle component that I really wasn't able to do in that setting. So 2 years ago, it'll be 2 years in July, I actually opened Harbor Direct Primary Care, which is my own private practice. It's membership based. And with that membership based model, I can really provide personalized care with an emphasis on lifestyle medicine.
That's incredible that you did that and took that leap to get in and do medicine how you wanted to. But let's start with the big picture. So, what are you seeing right now in your practice when it comes to women and burnout?
Yeah, I think it's just such an important topic. I am seeing lots of women just reach out to me because they are pretty dissatisfied with the current healthcare system and really trying to get the care that they need, but not able to find it. And I think that has a lot to do with, just maybe not being heard because there's not enough time. So I think women carry the burden of, mom, sometimes you have a job, you can be a wife, you can just wear so many hats. And at the end of the day, it's sometimes hard to take care of yourself. And sometimes women just want a more safe atmosphere where they can be treated just like a person, be listened to, and not just be always handed, here's a medication for that quick fix. But let's dive deeper and take that time that you need.
Yeah, absolutely. So, do you think it's the women are not being heard, or is it the structure of like the whole ecosystem of the traditional model itself?
I think it's a combination of both. I think we know a lot more now about women's health, about, hormonal changes, for instance, that, we're living longer and there is finally more research on it. And there are more prominent, figures in healthcare speaking out on it. So maybe the fact that women are finally, hearing that and saying, okay, well, maybe my symptoms or what I'm feeling isn't just normal, so let me reach out. And I think that's sort of what I'm seeing a lot more these days.
Why do you think so many women struggle with symptoms that dismissed as normal to begin with? Is that just the lack of understanding, like you mentioned?
Yes. So I have had the experience where I've, had a patient who was maybe on the fence of joining my practice and wanted to go the traditional route. And she comes to me and has seen multiple specialists, right? Let me look into your thyroid. Let me look at your brain. Let me look at some other labs to uncover what could be going on. And at the end of the day, everything comes back normal. And so sometimes the answer is not necessarily in labs. Even with hormonal changes, we can go through changes that are more symptomatic. And because lots of doctors have not been trained in the menopausal or perimenopausal treatment and, just looking at it, we weren't trained. Even I wasn't really trained much in residency. I had to learn it all after residency. So that's a big part, that this disparity in kind of like physician knowledge, I think, or comfort level. And also the fact that it could also not just be tied to hormonal changes, but more what's going on in our life. What lifestyle factors could really be contributing to what you're going through? And you'd be really surprised that once you take the time, the 60 minutes with a patient to see what's going on and actually, make some lifestyle recommendations, they'll come back a month later and say, "Wow, this is actually it's going a lot better and I've just made this lifestyle change."
Well, that's incredible. So there's a link between the hormonal health and then the chronic stress that they may be facing.
Definitely. But it's not always hormones, so I don't wanna come off like, if you're a woman going through stress, it's gonna be your hormones. That's not always true. But yes, definitely the hormonal changes that we go through, in our 40s and beyond can definitely increase stress and anxiety, depression, things that may come off as a mental health disorder, may not be a mental health disorder, may be a hormonal imbalance, or may just be an exacerbation of maybe you had mild anxiety when you were younger and now it's getting worse.
Well, interesting. So, and I know you mentioned this
Mhm.
before, but I want to talk about something like many women listening can relate to, right? That invisible mental load that you talked about. So it could be something else that we're going through in our just our life, right?
Yeah, so I don't think it's true with every family necessarily, but a lot of the majority of responsibilities will fall onto women a lot of times or the mom. And I think that that can become just really overwhelming because, you're supposed to be kind of holding the family together. And then at the end of the day, you may not have time to take care of yourself. And as a woman, at least I know me, I kind of just take on responsibilities that I could easily say no to. But sometimes I just don't because I can technically multitask. But it can get to a point where we're not making those lifestyle choices that may benefit us and help prevent chronic illnesses or treat something that's already happening in our life or to our body. I mean,
Right. Yeah. So how does this like mental to-do list, like you mentioned, I mean, it's so much on women, right? How does this affect things like our sleep, weight, anxiety, hormone function? Is it just making it worse or
it can. I think it just depends on if we're able to work on the things that will make us and our families healthier, right? So having that support like a doctor that can help you optimize the lifestyle measures, like creating nutritious meals with or for your family, understanding what to even buy at the store, so having more of a nutritional approach there, understanding that sleep has a lot to do with it and how can we improve our sleep without medications. There are definitely things that we can do throughout the day to improve our sleep. How can we get exercise or movement in? How can we surround ourselves with people and relationships that improve our health? All of these things are actually tied to our health and managing what we're going through already and preventing chronic disease. And I think that you've talked about that a lot on your podcast with other guests is it's all about prevention these days and longevity, right? And these are actual evidence-based, proven ways that we can prevent chronic diseases, live not just longer, but healthier for longer with these choices that we can make.
it seems like micro choices too, like just making a little bit of a healthier meal, like these little micro choices. I know we've heard that before. Do you think that we're underestimating how much this chronic doing is going to impact our long-term health? We make a lot of bad choices. Is that really going to impact the long term health?
I definitely think it does, and I think that's why the term lifestyle is used is because it should be long term, right? It should be not a quick fix, not a certain diet. I don't prescribe diets to my patients. It's more of lifestyle changes. What does your lifestyle look like now based on your culture, your environment, and how can we make changes that will work for you? Right? Because there's over information, there's misinformation, and I just want to help be the sounding board for my patients. I don't want to scare my patients into thinking they are making wrong decisions but knowledge is power, right? And I'm a big believer in balance as well. If you're doing your best most of the time.
Yeah, absolutely. I think a lot of people, maybe women especially, have kind of normalized being in this overwhelmed state. That doesn't mean it's healthy. So, how do you help women actually get back to into balance? How are you integrating this lifestyle medicine as a solution into your practice?
So, first and foremost, I just try to create just a warm environment for my patients where they feel comfortable. They're not taken just to an exam room or I don't take their weight right away. We literally sit and have a conversation about their health, about their life. And I carve out a full 60 minutes for my patients for their initial visit. And sometimes just listening and being able to figure out what could be, what are the issues that are bothering them. Of course, I use lots of traditional measures like I usually will get labs done. And so there are some basic annual labs that we do checking just overall organ function, checking your blood sugar for any insulin resistance. And then, of course, if a woman is at a certain age or having certain complaints, I will do more of a full hormone panel and then also get into some vitamin and mineral testing as well.
Oh, that's great. So, for our listeners out there, for somebody who may be listening who feels overwhelmed by even thinking about changing habits, what are one or two small doable changes that make the biggest impact that you've seen so far for your clients?
Well, I think one is sleep and really understanding what the habits that we're already in, how they could be affecting our sleep and in general, our metabolism and our mental health and just our mood in general. Just understanding sleep hygiene. Some simple fixes you can make, getting out in the morning, taking a morning walk, allowing that circadian rhythm to kind of reset. And then before bedtime, having a wind down time for yourself. It doesn't have to be long, it can be 10 to 15 minutes. Or fueling the right way. For instance, a higher protein dinner that is lower in carbohydrates will actually help you sleep better.
Still seem like super simple choices that can make a profound
That's it.
differences.
That's exactly right, and so that's always my goal is I want a patient to leave my office feeling like, "Wow, I was heard and this isn't overwhelming." Like, I understand my treatment plan, and I always think baby steps are the way to go, and also just understanding what your lifestyle is to begin with and how we can make things work for your lifestyle.
Well, we also know that you also look at women's health and you are dealing with hormones. Hormones are such a hot topic. They also can be confusing, especially as we move through different life stages. And sometimes that's hard to pick up, right? When you go to the traditional doctor's office. So, how do hormonal shifts look different? 20s, 30s, 40s, 50s?
Mhm. Well, the main thing in terms of our hormones is that it's really that drop in estrogen that we see as we enter into what's called menopause. However, there are years before menopause, which is termed perimenopause. For some women, that's only a year. Some women, it can be 5 years where they're actually showing symptoms of hormonal changes or menopause symptoms, but they're still getting their periods. They may be abnormal, but they're still getting their periods, and their labs may show that they still have adequate estrogen, but they're suffering. And so that's when it's not as clear cut. And that's when some other things may really help, like the lifestyle changes. Exercise is a big one that can help us through perimenopause, fueling our body with enough nutrients and the right nutrients. There are also some other hormone imbalances that happen, but it's really the estrogen that's at the center of it.
So you mentioned that they could be suffering. What are women supposed to be looking for in that perimenopause? Like, what are they suffering with?
I think that's what can be very confusing because they could have fatigue, for instance, just not feeling like the energy is there like it used to be. Sleep disturbances, that's a big one. Joint pain, some weight gain, especially around the midsection, is quite common. And then mood changes, just, I'm short tempered these days. I never used to be short tempered like this. It's not just, the mom rage, it might be actually something else. And, you hear that brain fog, you're kind of forgetful, you just don't feel like yourself as much anymore.
I
Yeah.
can imagine if you go into a doctor and you only have a few minutes and you just tell them you're a little bit more tired than you used to be, it's going to be almost impossible to figure out what is going on. When you're in or starting the perimenopause phase, if you do labs, is it pretty evident right away? Like pretty
No,
clear
it's really
cut?
not.
So,
No.
what are we supposed to do as women who now have this crazy mental load? I have no time to hardly schedule an appointment for myself. And now I'm just a little bit more tired and irritable than used to. How am I supposed to squeeze in multiple doctor appointments to explain this?
So, it really depends on, yeah, I think the environment of care that you're in. But there are options for women who technically have normal hormone levels and are going through the symptoms. So, depending on their comfort level, which I always want to know, are you open to hormones right now? Because something like an oral contraceptive pill really can balance out those hormones and still give you periods. There's also supplements that can be very helpful. And like I already said, these lifestyle changes cannot be understated.
Yeah, absolutely. What is one thing that you wish every woman knew about this perimenopause, menopause phase when it comes to maybe mental health and the metabolism?
Well, that it's not one size fits all. That just because you're going through something, your friend might not be going through the same thing. It really isn't black and white like that. And so I would say that if you do feel like things are off or your health has, changed, it's a good idea to seek out medical help to see if this could be something other than just, "Oh, this is my life," "This is how things are." And that it can happen at really almost any age. It's not 45, it's not necessarily 42, it can happen almost at any age.
That's really good to know. Speaking of like myths and misconceptions, because it sounds like you hit 40 and it's all downhill. Are there some other myths or misconceptions you hear around fixing burnout or the hormones or weight gain?
Myths? Well, I think that there's just a lot of myths around hormonal treatment in general and the safety. I think when done properly and, with a great health history, with our risk factors taken into consideration, hormonal replacement therapy is very safe. And one thing that I always tell my patients, because there's risks when we put anything into our body, and we need to know if the benefits outweigh the risks. And something like untreated menopausal symptoms can lead to stress, which is increased inflammation and risk of chronic diseases, cancers, weight gain, same type of risk factors, and just, poor mental health. So, would you rather have that? We're still, I think, lowering our risk of these chronic diseases overall by getting the treatment that we need. So, we always want to look at benefits versus risks and what the data shows. The data shows that these hormone replacement therapy, when done correctly under supervision, is safe for the general population. Of course, if you have certain risk factors, you may not be a candidate, but the overwhelming, majority of women are candidates.
That's really good to know. Okay, so for everybody listening, are there like your top 5 lifestyle prescriptions that you can give?
For lifestyle medicine, there are 6 pillars, and I try to stick to them in my practice, which is good nutrition or adequate nutrition, exercise, regular, moderate exercise, sleep and good sleep hygiene, relationships and who you surround yourself with, overall stress management, and then avoidance of risky substances.
If you need a place to start, you can look that up. And it sounds like easy ways that anybody can start improving their health today.
You don't have to go with all of them at the same time, start with 1 or 2. Write yourself what we call a lifestyle prescription. Write yourself a prescription. I will weight train for 30 minutes 2 times a week. Try that for a good 3 to 6 months before trying to increase it. It's all about longevity and sustainability.
And you mentioned making sure it fits your lifestyle, your culture, your
Mhm.
background. What can you do today? Just do something, right?
Yes, could not agree more.
And I'm sure so many women have felt seen and heard even in this conversation. You know, do they just call you?
Yeah, so, well, like I said, I'm a direct primary care physician, so there's an awesome tool called Direct Primary Care or DPC Finder that you can just search and find a direct primary care doctor in your area. But of course, if you're in Southern California, please reach out to me. I am currently accepting new patients and I would be happy to talk and set you up with an appointment.
I mean, a 60-minute consult is just unheard of, right? So,
Right.
I mean, that just sounds incredible for somebody who's just needs to get their information out there. Thank you so much, Dr. Ansari, for your insights on this topic. I hope more people are talking about this and more women are finding the care that they need. But before you go, we do ask all the guests on the show if you could share what are 3 fundamental pillars that contribute to your well being?
All right. Well, thank you, first of all, for having me on the podcast. I'm really honored to be here and to talk about something that I am so passionate about. So thank you, Riley. And in terms of, my pillars, I try to practice what I preach as much as possible. So for me, surrounding myself with loved ones and my family is a huge support for me. My husband, he's an internist and he just started working full time at Harbor as well. So he supported me from the beginning and just doing activities that enrich our life, whether it's healthy cooking, healthy baking, going on hikes in beautiful Orange County, the movement, and then just doing my own self care, which is getting out by myself and exercising whenever I can.
Well, Dr. Ansari, thank you so much. So, if you're listening and thinking, this is me, you're not alone and you're not broken. You're likely living in a system and a culture that hasn't made space for your full health. To learn more about Dr. Ansari and her work, check out the episode notes for her resources and links. If this episode resonated with you, please share it with a friend, leave us a review, and let's keep normalizing conversations about real women's health. We'll see you next time on Sofia Unfiltered. Thanks so much for listening. This has been Sofia Unfiltered, a podcast by Sofia Health, the #1 marketplace for health and wellness. Find services, classes, and products from the top health and wellness providers. Book an appointment or join live classes now. I'm your host, Riley Rees. If this episode resonated with you, we'd love to hear about it in the comments section of your favorite podcast provider or with a 5-star rating. Let us know what your biggest takeaway from this episode was, or share it with someone you hope to inspire. Join us again next time for more real conversations, stories, and insights that help empower you with the knowledge and inspiration needed to transform how we care for ourselves.